Hi, and welcome to our video. If you're watching this video, it's because your doctor referred you to our clinic because you're in need of a procedure called a colposcopy. Today we'll be covering what is a pap smear, what does an abnormal pap smear mean, what is a colposcopy, why and when do you need a colposcopy, and lastly, how can I prevent an abnormal pap smear? Let's start out with some basics. What is a pap smear? A pap smear is a test that is done to screen for cervical cancer. Usually this test is combined with a test for human papillomavirus, also known as HPV, the virus most commonly associated with cervical cancer. A pap smear test includes a speculum, which is used to visualize the cervix, and then we use a brush to obtain cells from your cervix. As you can see in this animation, the speculum goes in, we take a brush, and take some cells. These cells are then sent to the lab, and then you would get a result. So now let's move on to what does an abnormal pap smear mean. There are 5 different types of abnormal pap smear results. The first is atypical squamous cells of undetermined significance, also known as ASCUS. This is the most commonly found abnormal pap test, and it means that there are some changes in the cervical cells. The second type is low-grade squamous intraepithelial lesion, also known as LSIL. This just means that your cells were mildly abnormal. Next is high-grade squamous intraepithelial lesion, also known as HSIL. HSIL means that your cells have more serious changes in comparison to LSIL. The next is atypical squamous cells cannot exclude HSIL, or ASC-H. This means that changes in the cervical cells have been found and may raise concern for the presence of high-grade SIL, also known as HSIL. Lastly, the result can be atypical glandular cells. Glandular cells are found in the tissue that covers the inner canal of the cervix and are also present inside the uterus. Atypical glandular cells means that changes have been found in the cells are concerning for the presence of precancer or cancer. So, you had an abnormal pap test and you were referred for your colposcopy. As you can see, the colposcope is actually just a big microscope. Now, moving on to what exactly is a colposcopy. A colposcopy is a medical procedure that uses a special instrument called a colposcope that allows for magnification of cervical tissue. We apply dyes and stains to the cervical tissue, which cause potentially abnormal areas to change color. The tissue then is collected from those areas that change color using a tool that is similar to tweezers. This is called a cervical biopsy. In some cases, cells may also be taken from the canal of the cervix, and a special device is used to collect these cells. This is called an endocervical curettage. As you can see here in the animation, the physician uses a speculum and using the colposcope to visualize the cervix, then uses the tweezers to collect the sample of tissue that appears abnormal. Now, let's go into the risks and benefits of a colposcopy. The risks of the procedure include bleeding, pelvic pain, and infection. These rarely occur, however, they're good to know. The benefits associated with the procedure include identifying the presence of cervical disease. Another benefit is reassuring the absence of disease. And lastly, identification and surveillance of those women whose cervical disease can be safely observed. So now you may be asking, what are the next steps? If your doctor took a tissue sample, it will be sent to the lab to be analyzed. You should have the results back within 2 weeks. Your tissue sample will be assigned to one of 5 categories. First, you could have a negative result. Next, it could be assigned cervical intraepithelial neoplasia 1, also known as CIN1. Thirdly, it could be cervical intraepithelial neoplasia 2, also known as CIN2. Fourth, it could be assigned cervical intraepithelial neoplasia 3, also known as CIN3. And lastly, the sample can show the presence of cervical cancer. The next slide shows how cervical cells that have long-lasting infections, such as HPV or human papillomavirus, can change over time and become abnormal. Abnormal cervical cells may also return to normal even without treatment, especially in the younger women population. Now we'll go into some frequently asked questions. First question, why and when do we need a colposcopy? Your doctor referred you for a colposcopy because, as discussed, the results of your pap smear were not normal. Another reason for a colposcopy could be that your cervix looks abnormal during a routine pelvic exam. And lastly, you could have a colposcopy due to unexplained vaginal bleeding. Another commonly asked question is, am I going to feel pain during the exam? The answer is no. You shouldn't feel any pain or any sharp sensations. However, you may experience a pulling sensation, some mild cramping, and some bleeding afterwards. What happens after the exam? It's normal to have light vaginal bleeding or dark vaginal discharge for at least up to a week after the procedure. Now, it's important to avoid the following after your colposcopy. Do not use tampons or douches. Do not have sexual intercourse. Do not use a swimming pool or a spa for at least 2 weeks after your procedure. Now, what are the next steps? You should have your results within the next 2 weeks. And the next steps actually depends on the degree of your cellular abnormality. Your doctor will be in touch to discuss your results and give you the final plan for the next following steps. For now, it's your job to relax. You're in the best hands. Lastly, we wanted to discuss the prevention of cervical cancer. Certain ways to prevent cervical cancer include age-appropriate screening with pap smears or co-testing with HPV or human papillomavirus screening, close follow-ups, having protected intercourse, and lastly, the HPV vaccine. The HPV vaccine is recommended for everyone. It's usually administered in females and males ages 11 or 12, but you can start as early as 9 years old. Most recently, insurance companies are now covering females and males up to the age of 45. So if you haven't already had your HPV vaccine, please ask your doctor on how to get it. It can save your life. We thank you for listening to this video, and we hope you have a smooth procedure. And remember, relax. You're in the best hands.